A 25-year-old woman is evaluated for occasional episodes of palpitations. She describes the episodes as a sudden, abrupt onset of fast and regular heartbeats that feel like her heart is racing in her chest. The episodes are commonly unprovoked and are not related to exertion. During one episode, her blood pressure was recorded on as 100/60 mmHg and her heart rate was 185 min and regular. She has no significant past medical history and does not take any medications. She has no family history of heart disease. Physical examination is unremarkable, including no heart murmurs or additional sounds. She also reports that she has been self-treating by immersing her face in cold water during the palpitation episodes. Generally, she says, cold water immersion relieves her symptoms abruptly within several minutes. This maneuver terminates the palpitations by directly altering which of the following? A 72-year-old man comes to the office due to chest discomfort for the past 6 months. He describes a pressure-like sensation in the middle of his chest that is brought on by brisk walking. It lasts 2 to 3 minutes and subsides with rest. The patient has not had shortness of breath, palpitations, syncope, or lower extremity swelling. Medical history is significant for hypertension and hyperlipidemia. He is a former smoker with a 25-pack-year smoking history. Recent pulmonary function tests are consistent with mild chronic obstructive pulmonary disease. He does not drink alcohol. Blood pressure is 145/82 mmHg and pulse is 77 min and regular. Echocardiogram shows left atrial dilation, mild concentric left ventricular hypertrophy, and an ejection fraction of 62%. The aortic valve is calcified with restricted opening. Estimated aortic valve area is 1.6 cm2. No other valvular abnormalities are noted. Which of the following conditions is most likely responsible for this patient's current symptoms? A 73-year-old man is brought to the emergency department due to intense, constant chest pain radiating to the neck and interscapular area. The patient has had the pain for the past hour and describes it as sharp. He has never experienced this type of pain before. Medical history includes hypertension, type 2 diabetes mellitus, and chronic kidney disease. Blood pressure is 77/55 mmHg, pulse is 120 min, and respirations are 20 min. BMI is 30 kg/m2. On physical examination, the patient appears anxious, diaphoretic, and uncomfortable. There is an early decrescendo diastolic murmur best heard at the upper sternal area. ECG shows sinus tachycardia, voltage criteria for left ventricular hypertrophy, and T-wave inversions in leads V5 and V6. Serum creatinine is 1.9 mg/dl. Serum troponin I level is normal. In addition to adequate resuscitation, which of the following is the best next step in management of this patient?
A 38-year-old woman is brought to the emergency department due to an episode of syncope. The patient has felt weak and has not eaten well over the last 2 weeks. Temperature is 38.1 C, 100.8 F, blood pressure is 115/57 mmHg, and pulse is 48 per minute and regular. The oral mucosa is dry, and dentition is poor. An early diastolic murmur is heard at the left sternal border at full expiration. The lungs are clear. The abdomen is soft and non-tender. ECG reveals sinus rhythm with a 2:1 degree atrioventricular block. Laboratory results are as follows: leukocytes 13/500/mm, hemoglobin 10.7 g/dl, platelets 10,000/mm. Which of the following is the most likely diagnosis in this patient? A 56-year-old man is brought to the emergency department after being found delirious by his wife, who also discovered a suicide note. The patient has a history of coronary artery disease and hypertension. Temperature is 37.7 C, 99.9 F, blood pressure is 80/40 mmHg, pulse is 42 per minute, and respirations are 12 per minute. Examination shows diffuse bilateral wheezing. Extremities are cold and clammy. ECG shows profound sinus bradycardia with first-degree atrioventricular block. The patient is given intravenous fluids and atropine, however, the bradycardia and hypotension do not improve. Which of the following is the most appropriate next step in management of this patient?
A 44-year-old man with a 2-year history of type 2 diabetes mellitus comes to the office for a routine preventive examination. He feels well and has no symptoms. Medications include metformin and aspirin. The patient has a sedentary lifestyle. He drinks 1 or 2 cans of beer on weekends and has a 20-pack-year smoking history. The patient's BMI is 32.5 kilograms per square meter. Blood pressure is 153/94 mmHg and pulse is 82 per minute. The remainder of the physical examination is unremarkable. Hemoglobin A1c is 7.6%. At a previous visit 3 months ago, blood pressure was 149/92 mmHg. Which of the following interventions would most likely cause the largest decrease in this patient's blood pressure? A 77-year-old man is brought to the emergency department after repeat episodes of lightheadedness. Yesterday, the patient felt lightheaded while jogging and sat down on the curb to prevent a fall. A similar episode occurred 6 weeks ago. He has had some exertional shortness of breath associated with chest discomfort for the past few months but has had no headache, blurry vision, or chest pain. Medical history includes hypertension. The patient takes hydrochlorothiazide and low-dose aspirin daily. He has a 20-pack-year history. Blood pressure is 145/90 mm Hg, pulse is 80 per minute, and respirations are 16 per minute. ECG shows normal sinus rhythm with left ventricular hypertrophy. Which of the following is most likely to diagnose this patient's condition? A 33-year-old man comes to the emergency department due to palpitations for the past 2 hours. He has no associated chest pain, shortness of breath, or dizziness. Medical history is significant for Wolff-Parkinson-White syndrome with 3 prior episodes of supraventricular tachycardia. The patient does not use tobacco or recreational drugs and drinks alcohol only on social occasions. He had 5 cans of beer at a party the previous night. Blood pressure is 120/80 mm Hg and pulse is irregular. ECG shows atrial fibrillation with a rate of 180 per minute. What is the best next step in management of this patient?